When I was Secretary of Commerce in Virginia, I had the privilege of working with the Virginia Economic Development Partnership, and they are the lead economic development agency for the Commonwealth and the Governor's Office. Coming to present today is Rob McClintock. He is the Director of Research for the Virginia Economic Development Partnership. He's had over 23 years of experience, and he's going to give us just a little bit of perspective of both healthcare in Virginia and its impact on the economy and how it impacts our economic development site selection process. So please help me and welcome Rob McClintock from Virginia Economic Development Partnership.
Good morning. You know, I really appreciate the opportunity to be part of this conversation today. And just walking in, I saw a lot of folks that used to be in the economic development world, and guess where they are now? They're in the healthcare world. So Rufus and Anna McKean, welcome. And I'm really a little intimidated. One of the more important people in my life is here, my marathon training coach. And I'm very excited that Kevin Barger was here to get me through that experience. That's my part in trying to stay out of the health system. But there is some danger sometimes in these sessions that there will be some repetition. You might see a number or two that you've heard before. But as my pastor says, repetition is good for the soul. And when you get with Ned Massey's folks in line to register to vote, these are the conversations. We'll all be on the same talking points. But as many of you do know, and we take great pride, you know, Virginia has traditionally received high marks from outside observers on its favorable economic conditions and business climate. Some of those accolades include #1 rankings for best state for business from organizations like CNBC, Site Selection Magazine this year, Polina Corporate Real Estate, and a #2 ranking just last year from Forbes.com after 3 years of being #1. Much of our responsibility at VDP is trying to bring that favorable message out into the marketplace generally, across the world, not just the United States. Our other role is to successfully work and manage projects through some of those people Barry was talking about, the site selection consultants and the companies themselves who are actively investigating Virginia as a possible location. A number of factors go into that: workforce development, transportation, quality of life, business cost profile, labor relations, unionization. But I would submit to you more and more that quality of life and workforce development are integrated, and I'll come back to that, but are at the top shelf, particularly for the companies like you see here behind us. And as a couple of the speakers talked about, you know, business wasn't always having this conversation, you know, even 10 years ago, 15 years ago when I got into the business. And likewise, the economic development community was not in that conversation as well. We are now beginning to see a bit more closing the gap between business and healthcare and economic development and healthcare. And I think that's a constructive conversation, and if we do it right and we collaborate and we all stay connected with the same data, we will hopefully stay in that top tier of states that I talked about earlier. Clearly, the lexicon is changing. It hasn't flipped entirely, but it's moving that way. And even just within our own structure at the Virginia Economic Development Partnership, it's instructive to me, I think, that we have right now at least 4 members of our board of directors that their day job is in the healthcare community. And some of them, their extracurricular activity, we've got 2 that actually serve on boards for some of the major healthcare providers in Virginia. So that intersection is becoming closer and deeper. Now, the Secretary Hazel earlier did talk about the 18% number of the United States gross domestic product. And then other speakers have talked about how that compares with other countries. Well, I just thought I'd put the absolute number out there as well, just so you have that in your head, $2.6 trillion. It's a lot of shekels. And that's up from just a few years ago from about 16%. And the Hospital and Healthcare Association they're probably stealing some of their thunder from this afternoon, but they released a report and looked within the confines of the Commonwealth of Virginia. About $28 billion is the impact. And that is for hospital and healthcare systems only. So I would submit to you the federal number and the state number is probably well understated, because if you really think about the people who've been on the panel, who are on your slides, Merck, Pfizer, and even, I believe it was yesterday, Mead Westvaco acquired a company from Switzerland in the packaging business for healthcare products. So the way the economists slice the data, gets it down to these recognizable, safe numbers. But I would submit to you that the supply chain and the integration of this through the economy is much larger than that nationally and within the Commonwealth. To give you just some perspective on the job front, 12 million United States jobs, 12 million. And that comes in at about 8.4% of the national employment. That is a little bit higher than what manufacturing employment is in the United States, just to give you a benchmark. We're hearing a lot now about the resurgence of manufacturing, and I'm all for that, but this helps you benchmark where the healthcare piece is in relation to that. Within the Commonwealth, we put out some numbers recently that looks at over 400,000 jobs, and I do believe that this is understated, pulling directly from the Virginia Employment Commission data, and you can see some of the sectors. That gives you a snapshot. What that represents to Virginia is about 12% of total non-agricultural employment. So again, to make my analogy to manufacturing, that's over twice the size of the manufacturing employment base in the Commonwealth. The Healthcare Association, their study, they had a little bit less on the job front, but it was instructive to me that every community in Virginia, every community, had at least 5% of their employment in healthcare, and some communities 3 times that amount. No strangers, these are just some of the top employers in Virginia. 8 of the top 50 employers of Virginia are hospital systems. Now, a lot of these on the slide are urban areas, but you can imagine the importance of a healthcare system in rural Virginia, disproportionate maybe to the overall numbers in the Commonwealth. Well, you've heard a lot about Virginia's for job growth, and we are, Rob's for jobs, Bob's for jobs. Where a lot of these jobs are in the health and support occupations. A huge surge in recent and projected growth. We went through the recent unpleasantness nationally in the recession. This country lost 7.5 million jobs from 2006 to 2010, 5% of the employment base. Healthcare employment went the other direction, went up by 21%, actually had a net gain of over 1 million jobs in the country. Think about that in terms of cost, because going forward, the Bureau of Labor Statistics is looking at another close to 3.5 million jobs in this field just by the end of this decade. Over 30% growth from 2010 to 2020. That is double the rate projected for all occupations in the country. And after last week's jobs report, we need every one of them. 13 of the 20 fastest growing occupations in the country are in your field, either direct providers or folks that are in related support systems. Large office, administrative support occupations, technology. I was really glad to see that you've got a full panel this afternoon on the workforce implications. We need to meet the tsunami, and I think we can do that. But there are tremendous implications for K through 12 in education, the community college system, and the private sector workforce providers to meet this need. Years ago, I remember Barry was in the real estate business. Many of you may have real estate operations that you run or connect with. There are going to be massive implications for real estate and how is healthcare delivered, where is it delivered, if not solely on the hospital campus, maybe on a more distributed network, requiring some upgrades to existing facilities. That has enormous implications for not only you folks in this room, but the local planning authorities who are involved with zoning and land use and the local economic development offices. Convenience, access, and cost will be critical factors that play out in the discussion of where these facilities are and what they look like. The Urban Land Institute, they have projected about a 19% increase in the need for medical office buildings by 2019. In square footage, that means 64 million square feet nationally. That compares with 7 million square feet constructed in 2007 alone. Now, in the economic development world, it is evolving, it is changing. We track basic employment within Virginia that occurs within our borders. And we're now beginning to see an increased evolution of names from the healthcare field or supporting fields like life sciences, medical device manufacturers and related industries in our numbers. And just the last 2 calendar years, we see, if you can see the slide, we had over 167% increase in the number of projects that I would put, broadly speaking, in that category, with about 3,200 new jobs associated with that, and close to $1 billion, half $1 billion in new capital investment. That's tax revenue mostly for localities, way up from the previous 2 years. The last speaker made great note of this. From a project point of view, Virginia, you may know, has been a hot state for the introduction of data centers, the folks that run the cloud and all the data that goes on the cloud. Just last year alone, we had about a dozen data centers land in all parts of Virginia, with $1 billion of capital investment associated with that. Going forward, as health IT needs and technology needs and all the things that Dr. Grundy talked about go forward, I would see and project additional demand on the data center front. Those numbers aren't even counted in the impact at this point. Just some of the names that got associated with healthcare, in kind of my view, in the last few years. There are other names that should be on there. The other names that might surprise you, and we just grabbed some of their business, like Allianz. Some of their business is actually in health insurance capabilities. Battelle doing some life science research, normally maybe not thought of as in the healthcare field. Teva Pharmaceuticals out in Bedford, the world's largest manufacturer of generic pharmaceuticals. The federal government agency, we have a huge strategy to try to hang on to some of the operations in the federal government in Virginia, bringing some of these back across the Potomac. Farriva was a great capture for the Richmond area, where we were able to save the Pfizer operation in Eastern Henrico and bring in a French company to make new healthcare products. And the list goes on. In the last few years, this list could have included other names like Merck, the Korean Medical Institute in Roanoke, the Howard Hughes Medical Institute in Northern Virginia, UNOS here in Richmond, and SRI International in the Shenandoah Valley. Heard a lot about cost being a major driver, and no question it is. Virginia, with all the issues and the raising of costs, still relative to other states, has a good story to tell. We're about number 14 of the 50 states in what the average costs are for the family coverage for health insurance premiums, about 93% of the United States average. But as others have said today, the cost conversation is evolving to other areas. quality and accessibility of care is beginning to show up at the regional level with site selection consultants and their clients. This is where health data, statistics that can be commonly agreed upon and be part of the message that we need to build a unilateral understanding of what we think we should be saying. And that's where I think the Center for Innovative Health can be very helpful to get us all on the same page so that the data that Roanoke has is very similar in content to what Hampton Roads would have, so we can have companies and consultants making apples to apples comparisons. I won't say it comes up with every client, but increasingly it's getting in the top 5 as a quality of life component, simply as it relates to the quality of the workforce. And if you hear nothing else, workforce development, after you solve for where do you put the facility and the basic cost profile, workforce development is the #1 issue facing economic development prospects as they're looking, because they want to make sure that they're buying a workforce that lives by good principles, they show up for work, they're productive, we don't have a lot of absenteeism, and all of those are reflected in the cost profiles. Bottom line, it's about productivity. So the depth and the innovation. You buy the ability to innovate and stay profitable when you buy a community or region's workforce. That 20 years out gets to the company's bottom line. Communities are beginning to sort of get this message, but they're not all there, I would submit to you, and we all need to help them get there, and that's why this dialogue is so meaningful and so important. There are a few places where wellness and sports and outdoor recreation and just basic sustainability of good lifestyle is moving to the top in some of the economic development marketing messaging we see. The Roanoke Valley region has rebranded itself recently as an outdoor mecca, if you will. And frankly, they've integrated this into their outreach marketing, and we actually have a company, backcountry.com, a fulfillment operation in Montgomery County that located because of outreach and going to trade shows by companies who make products in the recreation and outdoor sports and fitness arena. Martinsville, Henry County, you all know what they've been through the last few years. They are beginning to build into their message and activate Martinsville, Henry County initiative. And it's important not only for the folks who are outside the community looking in, it's important for the folks in the community to feel good about themselves and what their capabilities are. And even in the coalfield region, the Healthy Appalachia initiative that the University of Virginia has been involved with has really begun to take traction, gain traction and momentum, and has led to other initiatives like entrepreneurship development. So we're excited about that. I just felt like this was important to put a few of these data points out there and sort of frame up the rest of the day. I don't pretend to be an expert on healthcare, that's your job, but we are in the messaging business. So I would like to thank you and Barry for having us as part of this, and wish you very well in the rest of your afternoon. Thank you. Take care.